These are the ones who didn't wait for a seat at the table. The visionaries, the builders, the leaders who move fast and turn obstacles into opportunities. Stories of vision and resolve, of risk taken and limits broken. The grit, the courage, and the moments that changed everything. Welcome to the table.
Bobbi Fisher, welcome to the podcast.
Thank you for having me.
So can we talk a little bit about what you do and what people come to you for?
Sure. So I am a nurse practitioner. Aesthetics and wellness is like part of our tagline, but as far as what aesthetics is, it's making people look and feel their absolute best. So we do injectables. We're talking like Botox, Lativo, Xeomin, Dysport, Daxxify, all of those brand name FDA approved neurotoxins, dermal fillers, lips, laugh lines, cheeks, things like that. We do biostimulator injections. We do PRP, which is where we draw out your blood and we inject that back. And then we do lasers and microneedling, anything that's going to enhance the quality of your skin. We also have facials, we have chemical peels, and then on the wellness side of things, we do hormone replacement therapy, weight loss, thyroid, and gut health. So everything but surgery and PDO threads you can typically find in our medical spa.
Okay, so can we talk about the hormone replacement therapy? Like I was growing up in the 90s, came out that, oh, this is not good for you. And now they're back to saying, oh, it's actually fine.
Yeah, so the Women's Health Initiative, the WHI, is really what drove a lot of like primary care providers and endocrinologists and private practice providers to stop hormone replacement therapy because there was a lot of misconstrued data that said, hey, if you start hormone replacement therapy in females, they are going to get reproductive organ cancer. And that's since been debunked. The study had a very small pool of candidates. Most of them were several years postmenopausal. They were using synthetic hormones. There weren't enough controls available to give accurate data. So again, it's since been debunked. There are still some very, very real risks, specifically with synthetics. It's not that bioidenticals don't come with any risks, but they don't just cause reproductive organ cancer. If you have active cancer, which we screen for malignancies, we aren't necessarily going to give you cancer unless it's something that is going to improve your overall quality of life. And then we would work with your oncology team. But like I said, just saying no to hormone replacement therapy because you think it is going to cause cancer, again, that's false information.
Yeah, that makes sense.
But I think the fact that I definitely worked in healthcare for several years before getting into aesthetics, that helped me build my clinical assessment skills, especially from the nurse practitioner side of things, because I have more advanced clinical assessment skills. I know how to rapidly respond and how to delegate to staff, how to manage complications when they arise.
So what inspired you to open your own clinic?
Well, I think not every practitioner, but most practitioners or clinicians who get into aesthetics, I started out as a patient first. So I had some insecurities. I think I mentioned it in my own podcast, and I've definitely talked about it on social media, but my initial inspiration was my acne scars. So I had really severe cystic acne as an adolescent, and because I didn't have the education and I didn't have anybody to guide me through that, I tried to pop it and I ended up with some really bad acne scarring from it. Didn't really know what to do about it. And it wasn't until I started doing my own research that I found out that there's this whole, beyond just basic dermatology, there's this whole branch of medicine for aesthetics to help you enhance the appearance and the quality of your skin. So, I got into it as a patient, and then that really opened up Botox and filler and Sculptra and all these other things. And that really lit a fire under me. I want to do that. I want to make people feel confident because I know how it feels to not want to leave the house because you don't feel confident in your own skin.
No, I used to tan a lot, and I came here and we did microneedling. And what was the laser that we did?
Pico laser.
Yeah. Can we talk about what that does for your skin?
Yeah. So Pico laser, we've got a multi-wavelength Pico laser. There's a 1064 or a 532 wavelength. And there's a telescopic lens or a fractionated lens. So we can use it for a variety of treatments. It's FDA approved for multiple indications for fair-skinned individuals as well as dark-skinned individuals. So it's very safe as long as the settings are appropriate for your skin type. But we for your purpose specifically, we were using it more for like photo rejuvenation or skin rejuvenation. So to help enhance the quality of your skin, improve overall texture, diffuse pigmentation. We can also dial those settings in for sunspots and tattoo removal, post acne marks. If you're somebody who's prone to like post inflammatory erythema or a red mark that really sticks with you after getting a bad acne breakout. So lots of different uses for it, but it's very protective. It spares the epidermis. So it's a non-ablative laser. It's not like coming in for resurfacing where you're going to be down for several weeks at a time. You are going to have some redness and some swelling, but usually the bulk of that downtime is the first 24 hours. Most folks are able to put on a tinted SPF and go about typical daily activities the next day.
Yeah, I had 0 issues. I think maybe I was down a day, but nobody could tell.
Usually, like the average person isn't going to know that you had any work done. Like the people that see you every day, your coworkers, your spouse, your kids, certainly the day up, they're going to be like, wow, you're really red. But the next day you look a little sun-kissed. If you're somebody who had like a really dark spot that we hit aggressively, that might look a little scabby, could potentially even blister. So that might need a little TLC and give you a little bit more downtime. But otherwise, for diffuse pigmentation and skin rejuvenation, about 24 hours downtime and you're good to go.
Can we also talk about the skincare that you sent me home with? I was hooked.
Absolutely. So you were sent home with the Epicurus skincare line. So it is considered to be like clean beauty. It's a botanical skincare line. It's a very gentle, and that's their whole philosophy, is just supporting the overall skin health and barrier. The oil cleanser is fragrance free. It helps break down any like oils on the skin. Oil is attracted to oil. So it really helps, especially like post ablative laser. When I send somebody home and they have to cover their skin in Aquaphor, kind of break that up, we need a good oil cleanser. And then the second step of the post laser skin rejuvenation skincare regimen would be our Epicurus lipid serum. That is a really natural, like anti-inflammatory serum. Some people will call it like the liquid gold.
It is.
Yeah. So I've not had anybody who's ever tried lipid serum that didn't absolutely love it. A little goes a long way. So the full size, if you were to come back and purchase that, that's going to last you 6+ months. You're using a pea size amount, and that easily covers the face and the neck. But you can use it again on a fully ablated skin. So if somebody comes in for a CO2, they can use that immediately after to reduce inflammation and cool. And then the Hivea cream is the moisturizer that's included. That's a thicker, like it's not an occlusive, but it's definitely a thicker, like healing balm. Most patients absolutely love it. It's not necessarily one that everybody feels comfortable using year round, because if you are on the oilier side or the acne prone side, it might feel too heavy during the warmer months. But otherwise, especially my more mature clients or folks who have dry skin at baseline, they absolutely adore it. And it's a really nice under eye cream too.
Yeah, yeah. No, I have dry skin and I love it. Like you can't beat it. It's the best I've ever used. I'm sold.
Yep.
I have noticed that I probably use the serum too much. I'm almost out of the serum, and it's just like, okay, I've been using this incorrectly.
That's why I try to tell people, like, truly a little goes a long way. And if you're somebody who likes to wear makeup and you put too much of that on, it will 100% pill up. You know, when you have too much product and you get those little white like flakes almost. Yeah. So truly a pea-sized amount, rub it into your fingers to warm it up and press it into the face and the neck, and you'll be good to go.
Can we talk about Botox and filler? If someone has never done those before, like what are your tips and tricks, and like what should they know about it before they try it?
Absolutely. So when somebody comes in for injections for the first time, you don't have to, obviously we're not going to hold you down and give you an injection that you don't want. You can come in just for a consultation. Whether you're booking with myself or with Katie or Isabel, my nurse injectors, we are going to go over your full medication history, your medical history, your surgical history, your any other injectables that you've had in the past, any skin treatments that you've done. If you're seeing an esthetician, your home skincare regimen, we're going to paint that clinical picture with your history. And then we are going to do an assessment to determine what areas of concern that you have. Sometimes you'll go see an injector and they might like point out specific things about you, but I don't like that. To me, that just feels a little icky. It's not necessarily wrong, but I prefer for you to tell me when you're looking in the mirror, what are you drawn to that you might want to change or what you want to improve upon? And let's create a plan around that. I will give you realistic expectations, say what I can or can't do. And then again, that's going back into the assessment. If somebody's coming in for talks, regardless of the brand, and they point to an area that they're going to need filler, I'm going to tell them, unfortunately, that's not an area that we can treat with filler. We're going to have to do a little bit of Botox, Dysport, etc. We just want to make sure that we're setting those realistic expectations. We like to create a plan around a budget. We have a membership available to make things a little bit easier to afford, so folks can bank as they go as far as their tox units, and gives them a little bit of a discount on their injectables. And then there's a custom facial involved as well that they could potentially sub in. And then they get a discount off of their skincare regimen too, just to help enhance their overall results at home.
So speaking of all of that, like when you are working with someone, you are trying to go for natural results.
100%.
Yeah. Absolutely. What does that process look like?
Yeah. So it all goes back to the initial consultation and setting those expectations. And then I've trained both of my nurses to approach each case, each patient with that same eye. We want to enhance what you already have. Of course, if there is something that needs volume added, if we need to augment, we can absolutely do that. But we want you to walk out after you're healed, of course, feeling more confident. We don't want to add to an existing problem or give you a problem that didn't exist prior to coming to see us. So we do a lot of dissolving work here, probably at least like 1 or 2 cases a month, I'd say, at least since June. And that is when somebody will come in from another practice, wherever that might be, and maybe they have had too much filler placed in their cheeks or their under eye or in their lips. We notice that it's migrated, it's not settled the way it should, it's from several years ago, but it hasn't naturally broken down. We will dissolve and wipe that canvas clean and then bring somebody back in 2 to 4 weeks, say, okay, now what are you concerned about? Is this something that you're wanting to do? Is it a good idea to refill? Do we need to use another product? Is there another way we need to approach this? So like I said, just really working with the client to make sure we get them the best aesthetic outcome, and we leave them just looking like a more refreshed, improved version of themselves.
So filler does dissolve. I saw a lot of TikToks over the past year, and they're like, filler doesn't dissolve. I was like, I think it does.
If it's placed into the appropriate plane, it will be metabolized by the body. However, if the wrong product is injected into the wrong plane, or if it migrates outside of the plane it was injected in, it will not dissolve because your body's natural enzyme to break it down doesn't exist in that plane of tissue. So that's where we need to use a synthetic version of that enzyme. It's called hyaluronidase. We inject that directly into that pocket of migrated filler, that unwanted filler, and it dissolves it almost immediately. It can sometimes take a couple of sessions. It really just depends on the product that was used, the volume that was used. It's a pretty quick process as far as the treatment. It's a little spicy, it can sting a little bit. But, you swell for a few hours. By the next day, most people are able to go back to their usual activities. Might have a little bit of bruising, but otherwise nobody knows you had anything done. Of course, the filler dissolved, things might, we're dissolving volume. So things may look like they need a little bit more volume. We give it a few weeks to heal, all the inflammation to resolve, and then we can go back and refill with the correct product in the correct plane to help people get back to that aesthetic goal.
Okay, so story time. What is one confidence transformation that has stuck with you?
One confidence.
Yeah, is there someone who you're like, oh man, this is why I do what I do?
Absolutely. I would say, anytime that you do filler, it's really nice because you get that immediate wow factor. If somebody comes in for lips, especially if they have a thin lip at baseline, and right then and there what the result's going to be. It's going to settle in a few weeks, but that is always nice. But if I had to pick one specific case, I would probably say going back to probably within 6 to 12 months of when we first launched energy-based devices in our practice, which I believe was into 2022, going into 2023. We had a patient who had lots of pigmentation, fine lines, had not been consistently doing injectables since relocating to this area. She came to see me. We started doing tox every 3 to 4 months. We did some strategically placed filler, some biostimulators, and then we did some laser resurfacing and some pixelate RF microneedling. And we specifically targeted her under eye area. She had some skin laxity and she had a fat pad that had herniated. And we were able to use our RF microneedling device to help tighten the skin up while also getting rid of that herniated fat pad or reducing its appearance. And looking at her before and afters at her next tox session, it was night and day. The texture of the skin, the quality of the skin, the reduction in that crepey under eye area, plus the reduction in her fat pad. Um, I I don't ever like to tell people like you're going to look 10 years younger, but when you get rid of that or you improve that, it really can wipe years off of your appearance, and it just puts confidence back into your everyday. Like when you look in the mirror and you recognize yourself again and you smile instead of starting to pick yourself apart, that's everything. That's why we're here.
What are biostimulators?
Biostimulators is anything that we inject to stimulate your body to create its own collagen or to try to heal itself. So Sculptra and Radiesse are the biostimulators that we use in our practice. They're a little bit different, but at the end of the day, they're trying to address the same thing, and that's collagen production, trying to improve the overall skin integrity. We can also do the platelet-rich plasma or the PRP, where we inject your own blood products back in to essentially do the exact same thing, is to stimulate more collagen.
So what are some common myths in aesthetics that you want to debunk?
Sure. That all filler looks fake or unnatural. Yeah, I was going to say poorly placed filler, the wrong product, the wrong area that it's being injected to, somebody with a heavy hand or an injector who just can't say no. Absolutely, you can look fake. You can look very alien-like. You could overfill to the point where, filler loves water. It attracts more water to the region where it's injected. So if you put too much filler into a specific area, that's how people get that like bogged down, waterlogged appearance in their cheeks. So again, filler has a bad rap because of injectors who don't use their license responsibly. But that's not the case here. We intentionally create aesthetic harmony. And I would say most of our patients, unless they're asking for a little bit more, like a full lip, they want a little bit more dramatic appearance, most of our patients are looking for that natural aesthetic result that, I can tell something's different about her, but nobody can quite put their finger on it.
So how do you decide what treatments or what products to invest in for your clinic?
So I'd like to know that the company that I'm working with is ethical. I want to see the data behind whatever device or product it is that they're offering. And I need good training on it. I'm not going to bring something in and just wing it. They're going to have training available to me. That needs to be something that I can replicate for my staff, so they're going to be confident using it as well. So whether it's a skincare line versus a device, we need to be able to make sure that we are using it as intended and that we are able to create a safe, effective treatment for our patients.
So if someone was wanting to work with you or support you, where do they find you online?
So they can go to any of our social medias, Instagram and TikTok. It's Bobbi, the NP _Luxe Lift. We also have Luxe Lift _Danville on Instagram. We've got a Luxe Lift Aesthetics and Wellness Facebook page. You can go to our website, which is luxeliftpllc.com. That has some services. You can take time to read about our team, see pictures of the clinic itself. And then there's also a booking link embedded there.
Yeah, Casey Toller did your website, didn't she?
Yes, she did.
So an amazing
She did a little brand refresh for us, updating it with current photos of staff, current photos of the space. We hadn't redone it for several years. All the information on there was outdated. We used to have like some stock photos on there because we hadn't taken the time to upload like our before and afters, photos of our staff.
Yeah.
Mostly because, we had done it ourselves. It was all DIY. So it was nice to be able to have somebody locally that could assist us with that.
Who did you use for your photos? They're beautiful.
Angela Rossi, also a local photographer. She is phenomenal. She's done 2 like clinic branding shoots with us. We are hoping to bring on another new esthetician after the first of the year. So we'll be due for another branding shoot shortly thereafter.
That was so funny. The Facebook post that was like from last February. Speaking of like bringing on people, what happened with that?
I honestly don't know. And all of a sudden it kicked off and got a lot of traction. We had posted in February, we were looking for a massage therapist, 1099 contractor to join us. We are wanting to have somebody come in like a couple times a month, either of an evening or on the weekends to do mini events with us. That's something that we're known for. That's helped to like really build our clientele. Our members absolutely love it, but we'll do a day that's dedicated to a specific treatment or service, or like a treat yourself day around Mother's Day. And we wanted somebody to be able to go from like a mini facial over to, for a mini massage, and then maybe go get their tox and, have a drink and leave. So we really want to be able to add that service on, but we have really struck out. And I'm not sure who went and commented on it that kicked it off, but all of a sudden I've got tags left and right on it and it's 10 months old. So
Yeah.
hopefully that helps us find a licensed massage therapist that wants to moonlight here.
Oh my gosh, that's so funny. Okay, so here's my last question for you. How do you define success in a way that most people would disagree with?
Yeah. I think a lot of people like to measure success based on like numbers and data. And while that's not necessarily wrong, I think success is more hinged upon, at least for me, work-life balance. That is a huge reason. Like I had that entrepreneurial drive because I wanted to create something for myself, but I also wanted to make sure that I was going to be available for my child, for my family, be able to spend quality time with my family. So being able to balance work and life, and also being able to live a lifestyle that I'm comfortable with, that is more so important to me than just a certain like dollar tag that's associated with success.
Yeah. No, I get what you're saying. That makes sense.
Yep.
I love that. Well, thank you so much for being on the podcast. I really enjoyed having you on.
I appreciate the invitation. Always a pleasure seeing you.